around this, you aim to diffuse retaliation from happening. I know when talking to MPD investigations, they say it's all about social media today that's generating a lot of this. They said one comment on a Facebook photo resulted in 4 assaults, 2 robberies, and 1 riot. And so what are we doing? I'm wondering if you are, or what are we, I guess, the city doing around that? I know other cities have embraced using analysis of public comments on social media and running through translation identifying to be able to reach out proactively to individuals to say, look, based on our analysis here, you're most likely going to be shot in the next couple of weeks here if you keep this up and if this situation doesn't diffuse over this particular incident.
That is definitely one of the things that we discussed when we first started opening up the Next Step program. Unfortunately, we've only been up and running for about two and a half months maybe, but this is definitely something that's been on the boards. A lot of the assaults and a lot of the gunshot wounds that have been happening or occurring have been based on Facebook statuses. I actually have a post on my phone from an incident that happened Friday night when a young lady was stabbed multiple times downtown in front of Sneaky Pete's. That video went viral on Facebook, and the young ladies who were actually friends before the post went up actually ended up fighting each other because the one girl looked at the video and felt like the friend didn't help her enough while on the scene or while she was being assaulted outside of Sneaky Pete's. So there's definitely a strong correlation. We talked about setting up a ping with the security staff. Something similar to what they have at the Mall of America, in which certain words kind of send off a little red flag for the staff that are located in the hospital. And we are able to kind of figure out who it is or at least get a picture or a description of what's going on before it happens. Unfortunately, we haven't made that step yet, but it is definitely something that is in the works. I do believe it will be beneficial. The other thing that we have been kind of contemplating was actually starting a Next Step Facebook page in which we kind of reached out to a lot of the youngsters or at least became friends with a lot of them so that we can kind of monitor some of the things that they're doing on their Facebook pages. The Next Step Facebook page would be more or less like a business page, I would assume, but it would be kind of geared towards the pictures, the updates, certain resources, places to go just to feel safe. A lot of the times these young people don't have places that they feel comfortable or safe in, so they just kind of hang out in the streets. And it's kind of messed up because the streets aren't as safe either. We have young people who have issues with their parents, and they end up on the streets and they ultimately end up hurt. And then during the intake process at Hennepin County, by us talking to some of these young people, they actually end up going back home and kind of restoring the bonds that they have with their parents and actually abiding by some of the rules in the house so that they don't end up on the streets. We have a couple young men who were shot earlier this summer who have been benefiting from our services in regards to us going to their schools, meeting their friends, just spending a little time with them, encouraging them, mentoring them, taking them to get haircuts. Just that little bit of time with those young guys gives them a bit of hope. So we're definitely working on trying to instill the value because unfortunately, by this going on for over 30 years, there's a lost sense of value within the community itself. And a lot of the incidents are happening because the young people don't value themselves as much as they really should.
I appreciate that answer to that. That's very helpful around that intersection with social media and covers more and beyond that a lot of the great work that you're doing. Also curious, do you have any sort of memorandum of understanding with the Minneapolis Police Department for information sharing? Because in a lot of these cases, it seems like unless somebody's getting shot or stabbed or beat up and they end up in the hospital, you may not directly affect or touch them. But I know MPD has done a lot or has a lot going on around information gathering and understanding essentially who's involved in what, and to be able to do some of that proactive outreach. I know that, we hope that individuals in the program, especially when they end up in the hospital, that's a wake-up call for them and that they're using that in this interaction with you to turn things around, but also are we getting to people before that pivotal moment where they're actually injured in order to try to turn them around ultimately, turn around the path.
Josh Peterson. Thank you, Mr. Chair and Councilmember Johnson. I didn't introduce myself last time. I'm Josh Peterson. I'm the Youth Intervention Coordinator with the Health Department. So specifically about the relationship with the Minneapolis Police Department, it's imperative to the success of the program that the young people feel that there is trust between themselves and the service provider, the case manager in this case. So therefore, it's imperative to the success of the program that the case managers are only sharing information with law enforcement if the young person wants that information shared. So MPD is a great resource and has been a great resource for this program in the sense that they are offering to help when help is asked for by the young person. But there is no formal sort of MOU or data sharing agreement with regard to the participants and sort of what they've been up to for that reason of trust and sort of the integrity of the program.
Certainly. I would wonder if there's some way to structure it so that it can be either one directional in that regard of here's a list of the youth who aren't on your radar, who probably should have some direct outreach, who we're afraid are a part of something bigger here, or just some way, though, to get to those youth in a systematic way to be able to offer support to them and still maintain that trust and the integrity of the program.
So I think the Inspiring Youth program, where there's other dimensions where that does happen, so that there's ways that we can identify youth who are more at risk and might qualify for other services. I think in the hospital program, the next step idea is it's somebody who actually comes in with an injury. Is that so? I think we, as the health department and as the city, do get that information from the police, but not necessarily going to the two case managers who are dealing with the next step program. Is that accurate?
Thank you, Mr. Chair and Councilmember Johnson. Yeah, I think that is accurate. So with the Inspiring Youth program, we will get some referrals from the police department, both through the juvenile diversion program and through some other means. And that is a way to hook up with those young people who don't necessarily come through HCMC with a violent injury. I think also Sasha's going to talk a little bit later about the GVI initiative, which will be coming up next year. I think that is sort of exactly what you're describing as well, which is using information that the police department, other law enforcement entities have gathered about young people, and then really being able to sort of turn that around, reach out, do some outreach, and offer some services and offer some sort of a different path forward.
Perfect. Well, I'll wait then for that part of the presentation. So thank you all for the work you're doing in the hospitals, reaching these youth.
And that said, also, as you know, this is 2 months old, and as it expands and we see how it works, there might be more opportunities to see how the Next Step program can communicate with the health department in general, so we can see, because there may very well be that some of the kids who are Inspiring Youth also end up in a hospital, and it would be nice if everybody involved was there to know and support them. Now, I see a couple other cards up. So, Councilmember Bender, do you have a question? And Councilmember Fry, is that an old question? I think it might be.
Oh, yes, it is.
Okay, Councilmember Bender.
Thank you, Mr. Chair. I just wanted to, could you, if you said it again, if you said it already, I apologize, but what is the lifespan of the grant that we have that supports this work?
A Josh question. A team effort here.
Thank you, Mr. Chair and Councilmember Bender. So we just got a grant that runs through September 30th of 2017. And there will be an opportunity to reapply for those funds for up to 5 years, but that funding is not guaranteed after September 30th of 2017.
And I have a not-so-secret plan that this program is so successful we can apply for the funds, and then we can also get a similar program at North Memorial, where a lot of Minneapolis residents, it's in Robbinsdale, but that's where a lot of emergency room that's used by a lot of residents too. Right now it's just at HCMC, much to their credit, because basically an ER doc reached out after we were trying to, find somebody who was interested, and we couldn't. And we sort of thought it's not ever going to work. But we had, I can't remember the doctor's name now, but we had an HCMC doctor who reached out and said, let's implement it, let's do this. So do you remember the doctor's name?
Yeah, Mr. Chair, Dr. Jim Miner is the chair of the emergency department there. He's been a big champion for us.
Great. Just to give him a shout out from it.
That's right. And you're correct that we do have a lot of interest in expanding this to North Memorial. And HCMC is committed to serving in sort of a teacher or mentor role. So the idea is if we can get this off the ground at HCMC, rather than trying to get things off the ground concurrently at two separate hospitals, we'll get it running successfully in one, and then we'll be able to sort of port that model over to North Memorial.
Thank you. I don't see any other questions on this, so maybe we can move to the next section.
Thank you all. Our next slide is moving into 2017 and advancing our tertiary efforts to interrupt ongoing violence. Slide, please. So group violence intervention is something that Josh mentioned about as far as our ability to identify young people who have great risk for being the victims of a shooting or other violent incident based on a data evaluation. So that is work that we are currently doing with the police department. We just recently got notice that we received a $250,000 grant from the Department of Justice for the next 2 years to be able to begin to implement some of the work around this project. It identifies groups or gang members. It uses the term group to make sure that we can include cliques and other groups that don't necessarily self-identify as gangs, but it's really speaking to group violence, so gang and cliques largely, who are causing the violence. So that's the first point of it. The second point is we really work with the community and social service agencies to try to identify the kinds of services that those young people would benefit from that could ultimately help them leave a lifestyle of violence and move into a pro-social life. And then in the event that young people choose not to take that offer, the law enforcement angle is a swift legal consequence for the choices that they've made that are invoking violence in the community. GVI is a model that's been used across the country. It's endorsed by the Department of Justice and has found to be greatly successful in lots of cities in reducing gang violence. So we're really excited to begin to explore how we can implement it in Minneapolis. Through the national initiative, Minneapolis Police Department has been starting to lay the foundational piece. GVI operates with 3 subgroups. So there's a law enforcement component, there's a social service component, and then there's what's called a community moral voice component. And so the police department has already been working on the law enforcement piece, and now that we have secured funding, we can begin to think about the social service and community moral voice aspects of the projects that we can get up and running. Slide. Coaching Boys into Men in Outreach is another grant that we recently received. It is focused on North Minneapolis, and the grant is from the CDC. It will allow us to engage young people ages 10 to 24 who live or go to school at Patrick Henry, North High, or Edison. So it's serving that chunk of the community. We hope to approximately have 1,400 outreach contacts with young people in that community. So we're partnered with the Youth Coordinating Board. And as many of you may have heard presentations from them in the past, they have had great success in engaging young people in the downtown community. We will now be expanding that service to the North Side community to be able to provide those same services in and around the North High schools of Edison, Henry, and North. And it will approximately reach 400 student athletes. The Coaching Boys into Men dynamic is really about teen dating violence and trying to encourage young people, particularly young athletes who we know can be leaders in their school communities, to be advocates to preventing youth violence. So it will give them a curriculum about healthy relationships and hopefully encourage them to become advocates in their school community on dating violence, but largely on violence in general in their schools. And that concludes our presentation for our 2016 work. If you have any further questions, please feel free to ask them now or to contact me. Thank you.
All right, thank you very much. I don't see any other questions right now. Councilmember Bender.
Thank you, Mr. Chair. I just wanted to comment because we had quite a bit of discussion about this work when Commissioner Musicant presented the Health Department's budget requests in the mayor's proposed budget. And I really appreciate the detail that you provided today about these programs. Every time I've spoken with leadership in our police department, they've told me that there's only so much we can do with enforcement. This is the leadership of our police department saying what we really need to do is go more upstream. And I think that, that's what this work is all about. And I really appreciate it. And I'm very supportive. If anything, I think we should be doing more to intervene in young people's lives earlier, to identify high-risk youth. We've heard about this new approach of intervening when there's a crisis, which sounds very transformative, but hopefully we can get to a point where we don't need to have 12-year-olds who've been stabbed or shot in the hospital. And so I just wanted to note that just because we had such a robust amount of questions and discussion last week.
Thank you, Councilman Bender. We do continue to try to do that upstream work in addition to partnering with the police department to make sure that we're dealing with the traumas that happen in the community in an ongoing way. So thank you for those words of encouragement. Thank you.
Thank you very much. And I'll look forward to the results report it comes back to. Now we're just going to receive and file this presentation. So I'll move to receive and file it. All those in favor say aye.
Aye.
Anyone opposed say no. Okay, that is approved then to receive and file. And the next item on our agenda has to do with the Senior Skyway Centre. And we're going to have a report from Christina Kendrick and also Sarah Goodnow. Is that correct? Sarah, maybe we'll come up later? Okay. All right, welcome.
Thank you. Council Chair Gordon, council members of the committee. We've kind of got a team here. There's some staff directives that we're reporting back on, which is kind of a collaborative effort between the Department of Neighborhood and Community Relations, who I'm the lead staff on the Advisory Committee on Aging, as well as the lead staff of the Minneapolis for a Lifetime strategy. So to start off, I'll just be mentioning the work that's been done so far in convening the Minneapolis Advisory Committee on Aging, as well as a conversation with the Health Department leadership and Sarah Goodnow, who's the coordinator of the Minneapolis Skyway Senior Center. And we have identified where the Senior Center's activities and purpose fit within the Minneapolis for a Lifetime strategy. The Minneapolis for a Lifetime strategy was adopted at the very end of 2013, went forward really robustly in 2014. We're actually working currently on a new action plan for 2017 through 2020. But some main components of the Minneapolis for a Lifetime strategy that the Skyway Senior Center addresses are obviously offering a healthy, safe environment, which provides opportunities for engagement, including civic engagement. We do use our senior center for our city's community engagement efforts, reaching out to that population. For leisure, entertainment, lifelong learning, they also have quite a bit of access to health and wellness resources and activities, which also fits within the Minneapolis for a Lifetime goal number 4 of expanding our partnerships to offer these opportunities and access. We, as I stated, the Minneapolis Advisory Committee on Aging did come together with Sarah Goodnow, the coordinator of the Skyway Senior Center. And so I was going to introduce Jean Greener, who is the chair of the Minneapolis Advisory Committee on Aging, and she is here to talk about some of the recommendations that were brought forward by the Minneapolis Advisory Committee on Aging, as well as some of the next steps that we're hoping to take.
Well, wonderful. Thank you very much. And I just want to note for the committee members that this report's actually a result of a staff direction and a request that we made. So we really appreciate that the Minneapolis Advisory Committee on Aging took that request to review this. And welcome, Mr. or Ms. Greener.
Hello, and thank you very much, Chairman Gordon and council members. It's a privilege to be here, and our Aging Committee has worked quite a long time on discussing priorities and needs of seniors. I'm the chair of the committee, so I'm here representing all of them. I'm sure that they would join with me in and expressing gratitude that you are working on the preventive programs you have for violence and with our youth. Seniors are pretty quick to stand back and say, take care of the young people first. But I'm here today to say we need to not neglect our seniors. I think at times they do feel like so much attention gets placed on the young people, which they all agree with. But seniors have needs, and we do have, as well as some well-off seniors in the city who love living downtown. I'm one of them. I'm living out Minneapolis for a lifetime dream. I love living downtown. We shop, we go out to dinner, we use the stores downtown, we walk through the Skyways. We love all of those amenities. We recognize there are a lot of seniors in the city who don't have that same kind of lifestyle. And the Skyway Senior Center brings together so many who are low income, who have a lot of needs, and who really don't know what all the resources in the center, in the city are. And I think that's one thing that's impressed me about the people who have run the center, Christina previously and now Sarah. They do have an understanding of what resources are there, how they can help. I think it's something like $15,000 is the average income of around half the seniors that use that center. I can't imagine trying to live on that, but I've worked in social services in the city all my working career, so I know that it's a reality. I think the Skyway Senior Center really fills an information need. It's a safety net. It helps people who don't know who to ask. It gives them a place to go for that. I think you all are aware of the real value seniors bring to the city of Minneapolis. The Skyway Senior Center brings real value, but don't underestimate the symbolic value it has to seniors all over the city. And that if we would have to close this center, we would certainly need time and a way to find a gracious way to do it that wouldn't reflect badly on leadership in our city. So we certainly would appreciate your consideration of bridge funding for 2017. We have worked on finding funding for 2017, gathering together the ideas of people in the committee and the community. But so many foundations and corporations have made up their budgets for next year, and we are not able to be a part of that. That is one of the areas that we would look into. So we ask you to consider the value of seniors in the city, the value that the symbolic Skyway Senior Center has, and also the very real value it has to seniors in our committee who need it. Thank you.
Thank you very much.
Council Chair, committee members. So some of the next steps that we will be taking, and when I say we, it's collective, it is Neighborhood and Community Relations, the Advisory Committee on Aging, as well as the Health Department. The Advisory Committee on Aging is going to be pulling together a subcommittee to do some brainstorming on everything from creative financing potential to who knows who, and connecting them to potential partnerships and other outside of the city community resources, and even talking about the potential that this may not be an opportunity to be sustained beyond, and what would that look like, and as Jean alluded to really minimize the impact that closing the center would have, particularly on those who do utilize the center. I do have also in attendance, Sarah Goodnow, the coordinator of the Skyway Senior Center, is here for any questions you may have on who uses the center, the current statistics, etc. Gretchen Musicant, the commissioner of our health department, is also here as well. So if there are any particular questions you have, the stats that I have are from when I left. So they would have a lot more current information on the progress that's been made to find partnerships and outside resources, as well as any updates to the demographics and users of the center.
So I guess I do have a question. I think that we approved some funding to get through the end of the year. And are we hearing from you right now that without some dramatic action, the Skyway Senior Center is going to have to close in December of this year? There aren't funds to operate past that, or are there some funds designated that might help a little bit with that?
Sure. I'm going to actually turn that over to Commissioner Musicant, who would have a better answer.
Okay, thank you.
Mr. Chair, Gretchen Musicant, Commissioner of Health. Because of some of the visibility of the tenuousness of the center that has made it into the media, there has been additional fundraising that has come in that will allow us to operate for the first few months of 2017 as well.
And just to be clear, there's no money in the proposed mayor's budget to help keep the Skyway Center open at this point?
Mr. Chair, that's correct. At the at the time the department was preparing requests, we did not know of the changes at UCare and that they would be backing out of their ability to sponsor the center, and so that wasn't part of the request that went to the mayor.
Okay. But we still do have the support of the property owner is giving the space free of any rent. Is that right?
Mr. Chair, yes, the property is available without rent. We do pay a monthly fee for cleaning and security and that sort of thing.
Okay. Well, thank you. That's all the questions I have, except maybe one other one, because I don't have any action prepared. I appreciate the letter from the advisory committee and the options there, and then the request now to help find bridge funding. I don't necessarily have a staff direction, and it seems like we're not ready to make a final recommendation. So what's the anticipated time where you might be ready to come back with more news or a recommendation on action that the council might have to take? It might be nice to take some kind of action and not just, are we in a holding pattern then until January?
Well, as Commissioner Musican stated, they were able to secure some resources to at least get them within a couple months into 2017. I do know that the part of the agenda for the October Advisory Committee on Aging is to develop the subcommittee to talk about these resources. Certainly a formal request if we still feel that bridge funding is needed, and I don't see that changing. We would definitely sit down with, the health department and come up with a request, and a timeline, as well as progress that's been made on our next steps.
So I don't think we need necessarily a staff direction, but I'm going to assume that we'll be able to touch base again early next year, see how the budget process goes at the city too, and maybe we can discuss offline when the next time to come back.
Absolutely. As Commissioner Musican stated, this has, I field calls myself, even though I'm no longer the coordinator of the center, and I'm sure the health department has received, as Sarah's nodding, this has really been brought front and center in the public eye. Media calling, just concerned constituents calling and asking about what's going on, what's being done. So with that also does come interest of potential partnerships. So there seems to be always ongoing conversations. So while we're optimistic, we are also reasonable. And partnerships and relationships, those do take time. Jean said it best. When this finally did come out public, et cetera, so many budgets were already established for 2017, which doesn't mean that moving forward, a partnership couldn't be beyond that. Clearly, that would be the goal. But it is a little more challenging to develop those type of relationships that are going to also provide the financial support needed this late in the game and the year, given most people's budget cycles.
Okay, thank you. I don't know if other committee members have any action or comments or questions about this. Seeing none, then I guess I'll just move to receive and file the report. All those in favor say aye.
Aye.
Any opposed? That motion carries. And that brings us to our last item on the agenda, which is discussion about a cooperative agreement for community engagement, energy efficiency pilot projects. And Peter Ebnett's going to give us the report. And this is one of the first things I think that we've talked about, which is some actual action that's come out of the Clean Energy Partnership. So we thought it might be worthwhile having a report before the committee, even a brief one. Welcome.
Thank you. Good afternoon, Chair Goodman, members of the committee. My name is Peter Ebnett, and I'm a management analyst
in the city clerk's office, and I've also had the privilege of working in the sustainability office over the past year. I'm here today to talk about a new initiative of the Clean Energy Partnership and to seek your approval for a cooperative agreement with the partners for the funding of this endeavor. As you know, the city is engaged in a first-in-the-nation partnership with our utilities, CenterPoint Energy and Xcel Energy, on meeting our climate action goals. By way of some background, on June 28th of 2013, the city adopted the Climate Action Plan, which seeks to reduce our greenhouse gas emissions by 30% in 2025 and by 80% in 2050. On October 17th of 2014, the Council passed new franchise and clean energy agreements with utilities, and these agreements committed the city and utilities to jointly and cooperatively study, coordinate, and implement progress on these clean energy activities. The partnership created an advisory body known as the Energy Vision Advisory Committee, who developed the pilot project before you today. In order for the city and utilities to reach these aggressive goals outlined in the Climate Action Plan, new and innovative ways of reaching utility customers with energy efficiency programs need to be developed and implemented. On March 4th of 2016, the partnership board made up of city policymakers, including Chair Gordon and Councilmember Glidden, and executive staff from the utilities adopted the proposed pilot projects and committed financial resources towards its completion. The pilot project seeks to contract with community-based organizations that have deep established connections with the community. These organizations will then conduct listening sessions with the community, develop plans based on that feedback, and ultimately implement strategies to drive participation in energy efficiency programs. Proposals are required to have a geographic focus on one or several neighborhoods in the north side or south side communities of Minneapolis. These areas were highlighted in the partnership's first annual report, from which this map before you was taken, as areas with higher densities of people of color, populations of limited English proficiency, lower and moderate incomes, and rental housing. These populations are targeted by the pilot project because they have historically been underrepresented in the utility programs. In order for us to reach our previously stated energy reduction goals, everyone, including everyone from all races, housing types, and languages, must be involved. In terms of next steps, the request for applications has been posted and we are awaiting responses. The partnership held a pre-proposal conference last week, and we had at least 10 organizations participate. Applications are due on October 12th, and by mid-November, organizations will be notified of funding. And finally, the work will start at the beginning of 2017. I do want to note representatives from the utilities, Elswin and Anibaka, are here today joining us and showing support. This concludes my remarks, and I'm happy to stand for any questions.
Thank you very much. I don't see any questions, but I appreciate you sharing this with us. I know that some of us are familiar with it because we have served on the board or been there, so appreciate that. I will then move to authorize this cooperative agreement for funding for community engagement pilot projects between the city, Minneapolis, CenterPoint Energy, and Xcel Energy. And thank everybody for being here. Seeing no discussion on that, all those in favor, please say aye.
Aye.
Anyone opposed, say no. That motion carries then. And seeing no further business before us, this meeting is adjourned. Thank you, everybody.